On Monday, the Georgetown Public Hospital's Nephrology and Kidney Transplant Department celebrated a milestone once considered impossible for Guyana. While it is not the first time the corporation has recorded successful kidney transplant procedures, it was the first time the hospital conducted a kidney transplantation on a non-national. As such, the atmosphere at the country's main medical referral center on Monday was one of pride and joy as the Minister of Health, Dr. Frank Anthony, joined in the celebration of this feat. However, such an accomplishment would not have been attained without the woman who made a decision to leave her country in search of a second chance to have a healthy life, a possibility she entrusted to Guyanese doctors. Who is this woman? She is 39-year-old medical Dr. Germaine Bristol, a Grenadian national. Bristol sat down with 90 News on Tuesday and reflected on her life prior to receiving the life-saving medical intervention while sharing her aspirations for the future. The mother of one was diagnosed with kidney failure in 2012 at just 30 years of age while she was studying medicine in the United Kingdom. As a medical student, she clearly understood the seriousness of her condition. However, she did not allow it to daunt her spirit.
When I received my diagnosis, I knew I couldn't change it. So all I had to do was learn to live with it. So that was the only choice I had. It's either I give up or I learn to live with it.
Immediately following her diagnosis, Bristol started dialysis treatment, which she continued for over 9 years until accessing the surgery. Dialysis is the clinical purification of blood as a substitute for the normal function of the kidney. Not only was the dialysis treatment physically taxing, it was also financially draining, Bristol said.
Since I returned from the UK, having to go to that one unit, there was a lot of times when machines were down, supplies did not arrive in time, and I had opportunities where there were times when I had to go to Trinidad because I did not have a choice. It's either I went without treatment and ended up in ICU, or I traveled so that I could get treatment.
According to Bristol, she has spent, I quote, a lot of money on plane tickets, end of quote. But after struggling with the cost of dialysis and the side effects of the treatment itself, a glimmer of hope was presented when a team of doctors visited Grenada to perform AV fistula surgeries on dialysis patients. AV fistula surgery involves sewing together an artery and a vein, usually in the wrist or elbow area, to create a larger, tougher vein that can tolerate multiple needle punctures that are needed for dialysis. After 4 unsuccessful attempts at the procedure, doctors began exploring the possibility of kidney transplant as a solution of ending Bristol's agony. But while Bristol was not against transplantation, she was not expecting her donor to be her 19-year-old son, Gerard Bristol.
Being a doctor and being a mother, the first thing that came to mind was possible complications of surgery and these things. And I remember actually asking him, "Are you sure you want to go through this?" And he got so mad. He was like, "Why wouldn't I want to give my mother a kidney?"
Bristol's doctor recommended Dr Kishore Persaud, head of the Georgetown Public Hospital Nephrology and Kidney Transplant Department, as the best man to facilitate such a surgery, and the rest is history. On June 14th, Bristol underwent the surgery successfully at the Georgetown Public Hospital, and both she and her son are recovering well. The woman is grateful that she is able to return to a normal life after suffering for so long. In praising the kidney transplant department of the hospital, Bristol vowed to recommend a local team to other renal failure patients.
I intend to go back and try my best to see how many patients we can get this to work out for. We already have plans in place to help patients raise funds and stuff like that to assist them so that they can come and get this done.
For the HGP Nightly News, Kendell Richmond.